Hello everyone, we have just described the acupuncture treatment prescription of stroke according to the meridian stroke and visceral stroke respectively. So I want to say a little bit more about this. In the treatment of stroke, we have repeatedly emphasized the therapeutic effect of the 12 well points. When we talk about specific points, we also emphasize the 12 well points have the function of awakening the spirit and opening the orifice. It is widely used in the treatment of stroke. So I'm going to give you a prescription for the specific use of the 12 well points. Before that, I'd like to invite one of you to review what the 5 transport points are. What kind of content does the 5 transport points of 12 meridians include? The 5 transport points of long meridian include 少商, 鱼际, 太渊, 经渠, and 尺泽. The 5 transport points of large intestine meridian include 商阳, 二间, 三间, 阳溪, and 曲池. The source point is 合谷. 商阳, 二间, 三间, 阳溪, and 曲池. The source point is 合谷. The 5 transport points of spleen meridian include 隐白, 大都, 太白, 商丘, and 阴陵泉. The 5 transport points of stomach meridian include 立对, 肋庭, 线骨, 解析, and 足三里. The source point is 冲阳. The 5 transport points of heart meridian include 少冲, 少府, 神门, 临道, and 少海. The 5 transport points of small intestine meridian include 少泽, 前谷, 后溪, 阳谷, and 小海. The source point is 万谷. The 5 transport points of kidney meridian include 涌泉, 然谷, 太溪, 复溜, and 阴谷. The 5 transport points of bladder meridian include 至阴, 足通谷, 束谷, 昆仑, and 尾中. The source point is 筋谷. The 5 transport points of pericardial meridian include 中冲, 老谷, 大陵, 间室, and 曲泽. The 5 transport points of triple energizer meridian include 关冲, 靨门, 中渚, 支沟, and 天井. The source point is 阳池. The 5 transport points of liver meridian include 大敦, 行间, 太冲, 中峰, and 曲泉. The 5 transport points of gallbladder meridian include 足窍阴, 峡谷, 足临气, 阳府, and 阳陵泉. The source point is 丘墟. So she just recited to us the 5 transport points of the 12 meridians. After reviewing the composition of the 5 transport points, we will study the 12 well points. In ancient times, there was a prescription about the 12 well points called 大结晶 prescription or 大结晶 acupuncture therapy. This prescription appeared in the medical literature of Yun Qizhi. But sadly, the work was lost. Later, it was included in the Precious Mirror of Health of Luo Tianyi. This prescription is specifically composed of the well points of the 12 meridians. This method can be divided into treating yang for yin disorder and treating yin for yang disorder. In the operation, it is in accordance with qi and blood flow order of the 12 meridians to select the well points of the 12 meridians in turn. According to the syndrome differentiation, after differentiating yin syndrome and yang syndrome, select a well point as the initial point. Then operate acupuncture according to the qi and blood flow order of the 12 meridians. Acupuncture the next point after the last point without retaining the needle. So let's see how that works. For example, if the syndrome differentiation belongs to yin-cold syndrome, now everyone thinks about the manifestation of the yin syndrome in stroke that we just talked about. If it belongs to yin-cold syndrome, we select the meaning of treating yin for yang disorder when using 大结晶 acupuncture therapy. When it comes to the specific therapy, it starts from Shaoshang of the long meridian and Shangyang of the large intestine meridian is punctured successfully, followed by Li Dui of the stomach meridian, followed by Yin Bai of the spleen meridian. Then the next is Shaochong of the heart meridian. After Shaochong, the next is Shaozhe of the small intestine meridian, followed by Zhiyin of the bladder meridian on foot. After Zhiyin, according to the order of meridian flow, it is Yongquan of the kidney meridian. After Yongquan, then it should be Zhongchong of the pericardium meridian. After Zhongchong, according to the order of qi and blood flow, the next is Guanchong of the triple energizer meridian. After Guanchong, the meridian qi is passed to the gallbladder meridian. Now it's time to needle Zuqiaoyin of the liver meridian. And then it should be Dadun of the liver meridian. This is in the order of acupuncture from lung to liver and from Shaoshang to Dadun. It is based on the order of the qi and blood flow of the 12 meridians. Its meaning and purpose is to connect meridians qi of the 12 meridians, so it is called Dajiejing prescription. If it belongs to yang heat syndrome, we select the meaning of treating yang for yin disorder. Now please think about the manifestation of yang heat syndrome in stroke that we just talked about. In the specific use of Dajiejing prescription, the start point is not Shaoshang but Zhiyin of the bladder meridian. Bladder meridian belongs to Taiyang, and Taiyang is a fence of human body. So the start point is Zhiyin of the bladder meridian. Then we needle Yongquan of the kidney meridian according to the order of qi and blood flow. Where is this point? Yongquan is the well point of the kidney meridian, which is at the bottom of the foot. After Yongquan, it should be Zhongchong of the pericardium meridian, which is at the top of the middle finger. After Zhongchong, the meridian qi is passed from pericardium meridian to triple energizer meridian. Then, which is the next point? It is Guanchong. After Guanchong, the next one is Zuqiaoyin of the liver meridian. Then it is followed by Dadun of the liver meridian, and the next is Shaoshang of the lung meridian. Then we should acupuncture Shangyang of the large intestine meridian according to the order of the meridian flow. After Shangyang, it should be Li Dui of the stomach meridian, followed by Yin Bai of the spleen meridian, which is at the big toe. Which point is after Yin Bai? It is Shaochong of the heart meridian, which is at our hands. And the next point is Shaozhe of the small intestine meridian. So, if it belongs to yang heat syndrome, we select the meaning of treating yang for yin disorder. The point selecting is starting from Zhiyin of the bladder meridian and ending at Shaozhe of the small intestine meridian. This therapy is Dajiejing prescription or Dajiejing acupuncture therapy in our clinic. This acupuncture therapy is a concrete manifestation of the use of the 12 well points in awakening the spirit and opening the orifice. We can obtain the effect of connecting the meridian qi by this therapy. It is used to treat symptoms such as numbness in the limbs of patients suffering from a stroke or sequela of a stroke. Later generations of doctors also carried out some expansion of Dajiejing prescription or Dajiejing acupuncture therapy. For example, some doctors have changed the use of Dajiejing prescription into source points and connecting points to use. So the specific operation is to begin with the source point of lung meridian, Taiyuan, followed by the connecting point of large intestine meridian and followed by the source point of stomach meridian. And the next one is the connecting point of spleen meridian. The cycle of these points is called Dajiejing acupuncture therapy. It is further development of the original Dajiejing prescription with the use of 12 well points. Those who are interested can look up the relevant materials and learn the corresponding contents. Okay, so far, we have introduced the acupuncture prescription for stroke. After class, we should remember the main points and match points. At the same time, we can also learn more about 大结晶 prescription we just mentioned.